Now there are 8 points that I've written. If this comes in your long answers, then please ensure that you write these points and elaborate your answer. Also include medical negligence freely anywhere, because this talks mainly about that. One is misdiagnosis or failure of diagnosis, which means what? That the diagnosis of the disease or that specific ailment has not been done correctly, and it also ignores or misreads lab results. Now, if the person, the doctor, well qualified professional, right, he is supposed to read lab results, say your blood report or your some other reports properly. But if he misreads hemoglobin values, sugar values, blood pressure values, all these are very important when the person is undergoing any treatment or say surgeries, for example. If he misreads, then he may administer a wrong dose of medicine. So it's very important that the diagnosis is done properly, and failure in doing so is going to really cost a lot on the doctor's part. Next is unnecessary surgery. Now, there is no requirement of surgery. Maybe the person may just get well with some medication for, say, 3 to 6 months. And the person and the doctor suggests, no, you have to perform surgery. Otherwise, the person may not stay alive. Now, that is an unnecessary surgery. So, performing such a surgery or even performing on a wrong side. Say, for example, the person is facing issue on his right leg, and the doctor performs surgery on the left leg. So what's the point? He is still going to face the problem, and you have rather created a problem on some other side. So unnecessary surgery. Third one is prescribing errors, which is wrong medication or incorrect dosage. So has to give medicine A and gives medicine B instead of A, or rather gives an incorrect dose of medicine A. Next one is lack of proper aftercare or follow-up. Now, you know that there has to be a follow-up when it comes to surgeries or certain treatments. So that has to be proper. Failing to do so may lead to medical malpractice or medical negligence as well. Next is premature discharge. Now, the patient has to be kept in the hospital, say, for 3 months or so after the surgery. But the doctor says, okay, you don't have money, you better leave. And after a month, he discharges you. Is that right? No, it's a medical malpractice. Other one is inadequate patient history. The failing to take an appropriate patient history or disregarding patient's health history is an important point. The doctor should take care that he understands the patient's medical history properly. Otherwise, it may lead to other complications. So the doctor has to take care. The patient is not going to be aware of anything. He has just come to you with an ailment, and the doctor has a responsibility to maintain that charts and all those kind of things. He is also supposed to look into the earlier history, the medicine that is administered. Maybe the person has undergone a heart surgery. Now he has come to the doctor for, say, some other ailment. So that has to be seen. Next is failure to order necessary tests. Now, not taking certain tests is going to give you false diagnosis. So again, it comes to point number 1, where there is failure to diagnose certain ailment. It may show something else, and because 2 tests were not performed, the person may be suffering from a disease A, and just because 5 tests were taken and 2 weren't taken, the information may mislead the doctor that the patient is suffering from ailment B, and he's going to give a medication likewise. So what's the use? A is still going to be there, right? So proper tests have to be taken. And lastly, failure to recognize symptoms. Now, this is one most important thing, that the doctor's duty is that he has to understand what is happening to the patient. So not recognizing symptoms is a failure on part of the doctor. He is trained for that, right? So this is one of the medical malpractices. Please write all these 8 points and see to it that you elaborate each point. Of course, you can talk medical negligence here as well and make a beautiful answer out of it.